state and nationally. Today, we are digitally releasing a report entitled South Central Rooted, a blueprint to dismantle multi-generational inequity and restore community health in South Central Los Angeles, and kicking off a series of conversations that are central to the analysis presented in the report, as well as our current political moment. We had originally intended to release this report with an art opening and panel discussion back in March. And while we had hoped to be together in community, we realized it was critical to move forward virtually. COVID-19 has shown a light on the racial disparities and systemic challenges that have impacted the health and well-being of our communities for decades, if not generations. We hope that this report and forthcoming dialogues will foster new thinking among community members, organizers, decision makers, and philanthropy to develop intersectional, long-lasting solutions to transform our public systems that currently create and maintain inequity. Now I'm going to turn it over to Laura Muraida to share key information about the report. Thank you.
Thank you, Sonia. My name is Laura Muraida, and I'm the Research and Communications Director at SCOPE. And I'm going to give an overview of our collaborative report, South Central Rooted, a blueprint to dismantle multi-generational inequity and restore community health in South Central Los Angeles. We're going to have a short period for questions at the end of this presentation. So please submit your questions via the Q&A box at that time. And then I will hand it over to Elmer and our panelists to continue the discussion. Next slide, please. Thank you. So on behalf of the South Los Angeles Building Healthy Communities Steering Committee organizations, we're excited to digitally release our report, South Central Rooted. South Central Rooted was born out of a series of conversations that the South LA Building Healthy Communities, which I'll also call South LA BHC, which are steering committee organizations, as well as partner organizations and grassroots leaders, had as we approached the 25th anniversary of the LA Uprising. As folks came together to commemorate this flashpoint in South Los Angeles' history, it led to a discussion about what has changed, what hasn't changed, and what it really was going to take. From these conversations, we began to articulate and refine a framework that we now call the Drivers of Disparity, as a way for understanding the root causes of and the current state of inequality in South Los Angeles. The 4 drivers of disparity are gentrification, displacement and homelessness, poverty, disinvestment and joblessness, policing, suppression, deportation and mass incarceration, and environmental racism. The goal was to develop an intersectional analysis rooted in South Central, but relevant to many low-income communities of color like it across the country. We wanted to foster conversations about systems change, to support political education, political alignment, and collaboration among community-based organizations, funders, advocates, and movements. We want to compile an updated South LA-focused analysis using academic and community-based research, public and ground truth data, and focus group and interviews with community residents, leaders, and issue experts. And lastly, we wanted to understand how grassroots efforts are moving the needle on changing unjust narratives and systems. Our key takeaways from this report are that South Los Angeles is at the intersection of multiple harmful policy agendas that are enacted in a coordinated and structural way, and ultimately prioritize profits at the expense of low-income communities of color, and Black, undocumented, and trans community members in particular. The data overwhelmingly demonstrates that South LA is disproportionately impacted by housing market forces. This has resulted in 63% of South LA residents being considered rent burdened, which means paying over 30% of their income on housing. Rent increases have also been occurring more sharply in South LA than in other areas of Los Angeles. And South LA continues to be among the areas in the county with the highest rates of homelessness. A review of the literature and data has also shown that as recently as 2015, 34% of South LA residents were living below the federal poverty line. That's almost double the rate of Los Angeles County. And in the same year, South LA had a 14% unemployment rate. However, despite a demonstration of need, a budget analysis conducted by Advancement Project for the South LA BHC shows that South LA City Council districts are not getting their equal share, let alone their equitable share of public spending on social programs and infrastructure. However, public expenditures on law enforcement and criminal justice are disproportionately high. South LA residents also rely on our public systems that are heavily policed, such as our public transportation and public school system. For example, in 2017, Metro approved a $446 million annual multi-agency contract for transit policing. This was in addition to $70 million spent on Metro security staff and an additional $82 million budgeted to contract with a private security firm. This is in contrast to one of Metro's top reasons for citations, which is fare evasion, which results in an annual loss of about $5 million. Lastly, our report demonstrates that environmental racism has resulted in pervasive industrial pollution, poor air quality, and other environmental health hazards. Recent data shows that South LA has about 0.9 acres of open green space per 1,000 residents, well below the 10-acre goal established by LA City Council. Data also demonstrates that there is unequal regulatory enforcement, health protections, and green infrastructure investment across Los Angeles. Each of these issues in the Drivers of Disparity have a wealth of data that demonstrates concrete negative health impacts and increased vulnerability. And we're seeing this clearly now with the COVID-19 pandemic. However, South Central has not only been shaped by the issues, but is shaping the issues and the political terrain on which they operate. Our report highlights that organizing, movement building, and grassroots activism rooted in South Central and its historical context is building multiple forms of power, shifting harmful narratives about low-income communities of color, and advancing systemic change across multiple arenas. Next slide, please. To learn more, please go to our website, southlaisthefuture.org, to read our executive summary, which is also available in Spanish, and to download the full report. We are also excited to share that South Central Rooted is not just a report, but is currently being developed into a multi-episode podcast, the first episode of which we are releasing today. The first episode, which is hosted by Elmer Roldan and Marlo J., sets the historical context that has shaped South LA. Please go to our website to listen to this conversation and our future episodes. Lastly, I want to also add that we are developing a popular education curriculum from the South Central Rooted report that we hope can foster dialogue between community members and community organizers. Again, please go to our website to stay updated with our work. Thank you again for attending this digital report release. I'll now take a couple of questions if there are any in the Q&A box. All right, not seeing any Q&A questions coming up in the box. That's okay. We're going to have another time to ask questions with our panelists. And so if there is anything that we can answer there. Oh, we got a great comment. Thank you. Just an appreciation comment. Thank you. And so there will be another chance to submit some questions later in our dialogue. So with that said, thank you for participating, and we hope you stay engaged with our work. We are hoping to make this report as accessible as possible and as usable and actionable as possible. So I do have a question here about just repeating the dollars that Metro MTA spends on ticketing. This figure is around their budget for policing and security on transit versus the amount that they lose on fare evasion. And this is 2017 data, which shows that Metro spent $646 million that year on a multi-agency contract for transit policing, as well as $70 million on Metro Zone security and $82 million budgeted to contract with a private security firm. And they lose about $5 million annually in fare evasion. All right, now I'm going to turn it over to Elmer Roldan of Hood Digest to get our teach-in and learning discussion started.
Thank you for that, Laura. I really appreciate the introduction and all of the background that you shared with us. And thank you to all of our participants for being a part of this webinar. My name is Elmer Roldan. I'm the Executive Director of Communities and Schools of Los Angeles. I am also the co-host of the Hood Digest podcast. And as Laura mentioned, the new co-host of the South Central Rooted podcast, which we're very excited to be launching here today. A little bit of background about myself. I'm an immigrant to the United States. I was brought here when I was 9 years old in 1989, and I've lived in South Los Angeles ever since. I grew up on King and Western, and I now live on Broadway and Slauson. I'm a graduate of LA Unified, and I'm a father of two boys, one of whom also graduated from LAUSD and is now attending UC Irvine, and then I have a son who's still in middle school, and we're all adapting to this new way of distance learning. As you all, I'm excited to have you all join us here today. The purpose of this webinar is for us to continue the conversation that this pandemic has elevated about the health of low-income communities of color, in particular the way that this pandemic continues to negatively impact communities of color in a very different way than it's impacting more affluent communities. The coronavirus has highlighted the ways in which the drivers that were mentioned contribute to the disparities that our communities have to bear and the vulnerability of Black and brown folks in America. It also sheds a light on the systems and structures that create these conditions, because we know that the problems didn't start 6 weeks ago when the coronavirus became more of an issue and we all got locked in our homes, but rather these are generational issues that have persisted for hundreds of years. And now that South Los Angeles is, one of the communities that's impacted by it, obviously it exacerbates those problems. We want to discuss the dominant narrative that continues to criminalize and blame low-income communities of color for these conditions, rather than looking at the systemic barriers that exist. And more importantly, because we are organizers and we are looking for solutions, we want to identify the way that residents, organizers, and other folks in our community come together to address these issues, to combat these conditions, and more importantly, to improve the health of our community. So with that, I'm very excited to be introducing our panel here today. I will start by introducing Janelle Bailey, who is the co-executive director of the Los Angeles Black Workers Center, where Black workers come together to increase access to quality jobs, reduce employment discrimination, and improve conditions for Black workers. Ms. Bailey has organized alongside Black workers to improve our communities and win back stolen wages since 2010. I love that. Welcome, Janelle. Thank you for being here. Our next panelist is Pete White, who is the executive director of the Los Angeles Community Action Network, a grassroots organization working to ensure the human right to housing, health, and security, making sure that those are upheld in Los Angeles. Pete White has been a community organizer in Los Angeles since 1992 and has educated and organized thousands of low-income people on a multitude of issues and campaigns. Thank you, Pete. Thank you for being here. And last but not least, we have Martha Arguello, who is the Executive Director of Physicians for Social Responsibility Los Angeles, which is committed to making the credible voice of physicians a powerful instrument for transforming California and our planet into a more peaceful and healthy place. I love that. For the past 32 years, Martha has served in the nonprofit sector as an advocate, community organizer, and coalition builder. We have a stellar panel here with us. Welcome, and thank you all for the work that you do and for joining this panel here with us. A bit of housekeeping before we kick this off. We are gonna be keeping time because we don't wanna keep folks here the entire night. We wanna make sure that we get as much information out to our participants as possible. We will spend our time reflecting on questions that we've prepared before today. We want this to be a rich discussion and invite you all to share your expertise, but also help us by being concise to allow other panelists to also participate. We have guests who are joining us here on our Zoom, and we want to allow time at the tail end of the discussion for them to also elevate questions to each and every single one of you. And for our guests, as a reminder, use the chat box to include your questions, and our team will do their best to elevate those questions and ask them of our panelists. All right, y'all ready? All right, there we go. So what we're gonna do is we're gonna kick it off with the most basic question that we can ask any organizer here today. And I'm gonna ask Janelle if you could please kick this one off. How has the coronavirus affected the issues that you work on in the community that you serve?
Oh yeah, that is a big question to ask everybody right now. I mean, it's in some ways in one regard I would say, oh, it's changed everything, nothing's the same. And in one regard I would say, it hasn't changed anything, everything is exactly the same. It's definitely both of those. I'm over and over hearing folks be like, everything is completely changed now. And it's true that there's been, just remarkable loss of life, jobs, material, things for everyone. But, repeatedly what we've learned is that everything that we've seen before in terms of inequality, inequity, the power dynamics that leave Black workers behind, that stuff is the same. I was talking with a friend of mine who said that we were in a moment where things that might have seemed impossible before are now possible. And he meant that it wasn't necessarily a good or a bad thing. It really depends on who has the power. So, there are some folks who seek to do harm who are looking at this situation and thinking, oh, this is it. This is my moment to, get rid of maybe the workers they didn't want to have in the first place. This is my moment to, continue to, trim off the backs of the workers. At the same time, is this a moment where folks can come together and push for things that frankly should have been in place for them anyway? So it's definitely both, having to, observe social distancing when it's typically our work to bring people together physically has, obviously been a challenge for everyone. But, one thing that I can definitely say about, our members and the team that, everyone works with is that it wasn't out of question. Like, you don't distance yourself from community in times of crisis. So we can keep the little 6 feet, but we're going to be together. You know what I'm saying? So, I did exactly what you said. Don't get long-winded with it, but yeah, it's changed everything and yet nothing. It's both of those.
That's beautiful. Thank you for doing that. And Pete, I want you to elaborate and tell us about the most pressing, immediate impacts that this is having on our communities, particularly the folks that you serve.
Cool. Can you guys hear me? Perfect. So a couple of things. There is no real distinction between very poor people and houseless people, right? Because when we think about the city and the county of Los Angeles, there are truly 721,000 families who before the COVID-19 pandemic were barely hanging on, right? And with a 50% unemployment rate, we're going to see more of those folks who are without shelter and without housing in rapid fashion. I think what has happened with our organization and many other organizations is we've had to pivot, right, from a political powerhouse, leadership development type of organization to a really mutual aid, power building type of infrastructure. Like many other organizations, we weren't ready to go mobile with our organizing, right? And by the grace of God, we didn't have to. And so there's been a number of folks who have had to sit it out and who've had to work from home. But then there's others who have just said, no way can we abandon a community that's been twice, 3 times abandoned before this COVID crisis, right? And so what does our mutual aid work look like, right? When we think about the drivers of disparity, and I'm looking over at Janelle, I'm gonna cut it short. But when I think about the drivers of disparity and the ones that are impacting us, yes, they've always impacted us. But when I look at houselessness, when I look at the lack of healthcare, when I look at things such as the inability to shelter in place and the response from the state is policing, or the response from the state is no testing, meaning that the community had to step in and step up to build sanitation stations, to secure masks, and to fight for testing. It's more of the same. I will say, if it had not been for community organizations, as well as just good people in Los Angeles saying we are going to join together to fill the gap, we'd be in a world of hurt right now. And so while we're hurting, there's also opportunities that we'll talk about as this conversation goes on that lay in the horizon.
Thank you. Thank you for that. And you all can't see it, but on the side of me, I have my team distributing care packages and checks out to our members here today, because like Pete mentioned, we've all had to step up in that way for our families. Martha, I'd love for you to share how other major disasters or disruptions have impacted or shaped South Los Angeles.
Well, I mean, I think, the history of South LA, from the Watts riots to what happened in 1993, those have really shaped the political side of South LA. But I want to kind of rephrase the question, because South LA has been formed by a number of industrial forces. We've often had homes located with industry. We had the railroad that cut through the city. We had major manufacturing. And so while those aren't disasters, they are the forces that have shaped and determined the soil that we live on, the air that we breathe, and the water that we drink. And that legacy of contamination has run up against this pandemic, where we understand that if you live near heavy traffic roadways, if you are living near contamination, that weakens your immune system, that weakens your lungs, and so it makes you more vulnerable to COVID. And we know that that's the same in terms of climate change. The same people in South LA are more vulnerable to increase in heat days. And I keep thinking of what is going to happen as the summer progresses and things get hotter, and folks don't have air conditioning. There's folks who are not housed, and then there's folks who are housed but are, maybe at risk of losing their utilities and other things. So how will they respond in an era of social distancing to the need for cooling centers and other resources? So I tend to think of, sort of 100 years or more of disinvestment, of treating all social problems like they're police problems. All of those are, catastrophic. And we see now just how thin gossamer thread has been holding this economy together. And we've been falling through the cracks in that economy for a long time in South LA.
Thank you for that. Pete, I'm going to ask you to build on something that you started earlier, but can you talk about the the drivers of disparity that are being most elevated by the coronavirus pandemic?
Yeah, I think when we think about the drivers of disparity and their elevation, um, I don't know if it's elevation, it's more of the unmasking, right? And I think it goes back to Martha's Gossamer thread point, right? And so houselessness and gentrification has been with us a long time. But what we didn't talk about when we talked about drivers of disparity was redlining and segregation, right? And you think about the inability to build wealth and how generationally that's held entire communities back and down, right? And so what you're starting to see now, and not just with houseless people, when we're thinking about drivers around displacement and houselessness, I don't know, I've been out and about since and of course I've had my PPE and I've been masked up, but I've been out and about doing work since COVID-19 hit. And I've, from Torrance to Harbor City to the Valley, I'm seeing food banks and food lines with brand new SUVs and people storing up, allowing me to realize that sort of this myth of meritocracy, right? This idea that we had it all good for a couple of decades is really, really thin, right? You're seeing the SUV folks. You're seeing the folks who had, they thought, decent jobs, really worried, concerned, and struggling right now, right? And so when I think about those drivers, when I think about gentrification and displacement and houselessness, I'm really looking out the front windshield. I'm really thinking about, so what does it look like? What does a real rebuild effort look like? Because we know that if the mayor is correct and there was a 50% job loss, right? And that's citywide. But then when we think about South Central Los Angeles, when we sort of team up the numbers of unemployment, and disconnected from the labor market that we've been struggling with forever, that number is always teetered around 50, 60%, right? And so what does it look like when you bring all of those forces together? And like, how do we prepare for that, right? And so I'm really, a lot of my work right now is, holding it down, the mutual aid, but also figuring out, because there's going to be a very politicized and a very political rebuild effort. There's an estimated $2 billion it's estimated, that's gonna come here from the federal government. And folks are already clamoring around those resources. And we need to make sure that we're organized in such a manner that it's not bailouts for local corporate entities, right? And that we are developing some sort of jobs programs. And this is one of the opportunities that really looks like the old school CETA program, right? That can actually begin to lift our folks up and out of this crisis as well. And so there is a world of hurt, but there is some opportunities that we've got to get ready for. We got to get organized for.
And Janelle, I'd love for you to talk about workers, Black workers in particular. There's a outcry, people out protesting, demanding that we open the country back up, that we open the economy back up. And that will be largely at the expense of service workers, many who are African American, and who as they demand that the economy open back up, is really demanding that they expose this particular set of workers. So I'd love for you to talk about what we see coming as a result of the economy opening back up and those who will be disproportionately impacted.
Yeah, you said it really well. That demand that the economy open back up is a weird way to phrase it when it's really, I demand y'all go back to work and serve me. It's not even a demand that I go back to work. It's a demand that y'all go back to work and get my stuff ready. And who is y'all? And who is this? It was oddly reminiscent of, we know what this is. This is some Confederate nuts. Like, I can't even sugarcoat it, right? And I think it hits particularly hard as, like I was saying, the coronavirus, the crisis around this is really just on top of, it just deepens the existing crises in Black communities. And so it's not like, we got to take a break from the public lynchings during the coronavirus. So this is all still happening at the same time. The Black jobs crisis didn't stop. It got worse. And so looking, you know, like some of the numbers that people sharing, like on the national level, they're saying that 45% of Black folks lost jobs, hours, you know, due to this. And we know those numbers are messed up because they're not counting how many jobs you got, which jobs are jobs, which jobs are not, who's your employer. So it's honestly, it's a hot mess. You know, and as we talk about reopening, you know, what is the plan as folks go back, and how do we start to go back safely? Because corporations essentially, you know, got a gun to people's head. It's like, do you want to eat? You know, you got to come back to this, you know, this unsafe job potentially. So it really puts, you know, folks in a wild place. And so, you know, we can talk some about, you know, like policies like hazard pay and right to recall and, you know, workman's comp, which is great for people to have access to. But at the core of it is really, you know, the way our economy is structured. The economy is not like it just is. The economy is structured as a result of choices and policies. And the way that we've got it set up right now, it has a shelter in place that tends to protect wealthy white folks and puts people of color, workers, in harm's way, even while calling them essential. And so we have to decide that we care. That's what is at the core of it. We have to decide that we care. We have to make the decision to give a shit about Black workers. That is what is at the core of it. We have to decide that we care. And it has to come from, you know, a genuine place of, you deserve to be housed whether or not you work. And that, unfortunately, is controversial. You know, we have to decide that we care about people at that level. And unfortunately, you know, for some folks, while they might be thinking, you know, it's a us and them, you know, situation, this is a community crisis. This is about public health. And so it's not like, oh, well, those folks over there can get, you know, infected. We can't be well until we're all well together. So we really do have to it is imperative that we make that decision to care about everyone.
I ask you to elaborate on a topic that's being debated at the federal level, and that is that they're proposing that employers be held harmless if their employees are exposed and result in getting sick. And just, you know, has your organization monitored that discussion, and just your thoughts on it?
Yeah, I mean, obviously, yeah, we're watching these things are changing, you know, super fast on the daily. I'm seeing a lot of stories about, like, folks, there's a Tyson plant in Iowa where more than half of the workers tested positive for COVID. There was another chicken plant where they had 900 people test positive. There is no way in the world that we could say that these employers are not liable. I mean, the obvious, you know, right here in our communities, we got warehouses who across the country, you know, we're seeing really high numbers of folks getting impacted and infected. And actually, one of the programs that the Black Worker Center had to jump into, we partnered with St. John's to bring mobile testing on 54 and Crenshaw. And, you know, it was really weird. Someone was asking me, they're like, oh, we had a great day. We saw all these people. And it was hard for me to agree that it was a great day, because at the moment that folks are depending on the Black Worker Center to bring healthcare to them, that's really a sign of the times. And so it's hard for me to, you know, agree that is a great day. But the idea that employers who facilitate these spaces in which people don't necessarily expect to come home healthy is outrageous to me.
Yeah, that's powerful. I want to ask each and every single one of you about the ways that your organizations are positioning themselves to support communities in this time period, and how it particularly has impacted you. Some of you have started, you know, touching on it, you know, in different ways, but I'd love for you to explicitly talk about, you know, how you, you know, are responding to this as an organization. So I'm going to start with Martha.
So we've had the realization that we work with two very, very different sets of frontline communities right now. We have, you know, for the last 20 years, PSRLA has worked with communities directly, right? Communities living in the front lines of pollution, of contamination. And suddenly we find ourselves, the members that we usually try to mobilize to bring to communities to support them in policy fights or whatever, stop an oil drilling, whatever that is, they are now on the front lines. They are the healthcare workers. And so it has been a real interesting challenge for us to figure out, oh, we actually have to serve our members and figure out what they need. And so we've been talking to our board members and some of our more active members, and they're exhausted. They are exhausted. And we also know some of our members were retired, and they're going to be called up to do service, right? As we, luckily we've slowed the progress so that they're not being called, but we know, if we'd not gotten a hold of this, medical students would be called in to provide service in a way that they don't normally. So we're trying to understand both of those dynamics and the needs of both of those communities. We're supporting our frontline partners in figuring out what their needs are, but because we do a lot of policy engagement, and that's an area where, democracy, the few places that we had to participate are getting more narrowed. So we've now, an environmental health and justice organization are dealing with digital divide. We're dealing with the fact that our communities don't have access to internet, they don't have computers. So how can they join a webinar or a webcast of a California Air Resources Board meeting or a South Coast Air Quality Management meeting or any of those places where our voices were silenced anyway, right? And particularly South LA, right? There is a lack of understanding of how deeply we are impacted by environmental racism and contamination from the organizational level to our elected representatives, because they've been sort of bought out in many ways by some of these agencies that are also bought by the industry. So all that to say is that we're trying to figure all of that out, right? How do we do all of our work in organizing and mobilizing online, and how do we prepare for when we can start meeting with people, and how do we the one thing we found is that our doctors and nurses are, everything we've asked them, hey, can you do this video, can you do this, they've said yes. They now, in a way that, I know that they felt, but now they understand, what, we've got to step out of the clinical role no matter how hard it is, because we cannot cure what's wrong just in a clinic. Right, and so that's related to this drivers of health disparities. But the other thing is this understanding the role that the economy plays in our lives. Now we can't deny. And I want to go back to something Janelle said. We need to care, we need to care, we need to care. And we need actually a caring economy. And right now it's actually possible to talk about it. And the governor's office was talking about, we need to leap into a new economy. And, we're part of this national work around leaping to a new economy that's based on caring, that's restorative, and so we've been working on that. So more of the same, right? And now it's even more urgent because we see the COVID capitalists, organizing themselves. We see the governor's new economic advisory committee. It's COVID capitalism, it's disaster capitalism, and that will not work for us. And the other thing that I keep saying in these policy spaces, we don't know how to do justice-based policy. We don't know how to do it. We haven't been able to. And it's an issue of power. And this is a moment where, the failure of the system has real power for us to engage in a new way.
COVID capitalism, I haven't heard that term before. So I'd love for you to elaborate on that. And in that same context, there was a report this week about how the healthcare industry, particularly workers, are losing pay because the healthcare industry is being impacted during this time period. But in the same sentence, they're being called to step up and risk their lives to, and serve. So can you talk about those two?
Well, the COVID capitalism term actually comes from the work of Naomi Klein and others when she talks about the shock doctrine. Shocks to the system allow the right to organize capital, to reorganize itself, re-entrench itself, and really, shape the so-called solutions, false solutions. And so we have to stop. We saw disaster capitalism in Puerto Rico. We've seen disaster capitalism in New Orleans, and we will see it now. And Jeff Bezos is now a trillionaire, right? Because so I think that there's this concept that tech was really planning much of this, like take everything online. And this is giving them this opportunity to really further entrench their power. And we see the COVID capitalism throughout the stimulus. Who's going to get money? Are we going to bail out oil? Oil is cheap right now. This is the perfect opportunity to transition because we see how vulnerable it is, right? We're going to dig in our heels, and even some parts of labor that should be with us are going to dig in their heels and fight for money to defend dying industries when we should be figuring out just a whole new system, because this one is not working for anybody. Well, except for the few billionaires.
Got it. So Pete, I'm gonna ask you the same question, and just the ways that your organization has positioned itself in this time period to support not only your members but Los Angeles as a whole.
Yeah. So a couple of things. Just building off something that Martha said a second ago, I was just thinking about our ability to affect policy. And there's a quote that someone gave me a number of years ago that says, law represents the voice of those in power at the time, right? And so all of the laws and all of the power effectively represents whoever had the power at the time of their writing. And so the question for me becomes, what sort of power are we building right now to shift the ways that this sort of COVID-19 capitalism is going to swing? We know for sure that the capitalists are not into losing, right? And so it's a very interesting time for us, right? When we watch the governors and we watch the mayor come up with money to talk about hotel rooms and figuring out long-term solutions for housing and money that didn't exist before, right? And so for us right now, we're trying to use this moment to set precedent, right? To say, not during Los Angeles's Hurricane Katrina moment, which is what I call COVID-19, let's make sure that level of investment that you are rhetorically talking about, right? Because behind every assertion, of course, there's another fight, right? Like each time they say we're about to do something, there's a fight to get them to do that. But because they made the assertion that they could, how we can hold them to it. For us organizationally, it's been, I'll tell you, it's been hard, right? It's been hard. We're based in Skid Row, right? Our home, our Justice and Wellness Center is in Skid Row. It is difficult to turn folk away who come to the gate, right? Who are coming to the spot because that's home, right? Who are coming to the spot to volunteer, who are coming into the spot to organize, and not being able to say, yo, come on in, everyone's welcome, right? And that impacts not only the folks who aren't able to come in, but our organizers as well, because this isn't an orientation as organizers that we're familiar with, right? Additionally, we weren't, like most of us probably on this call, we didn't have the infrastructure set up for online sort of engagement, right? And so some of the early resources that I was attempting to raise was to get good internet, to get good computers to folks who could not work out of the office, right? Just to make sure that we had infrastructure that could keep us moving forward. I think the other thing that has been promising, though, a little different for Martha, we walked into COVID-19 and sort of the social distancing, thinking that most of our engagement with our folks was gonna have to be on the phones, or almost like Cyrano down below people's windows saying, you know what it is? But we put out the Zoom, we put out the Google Hangouts, and folks responded, right? Folks responded on their Obama phones, right? Folks responded with the limited access that they had. And so the transition, while it hasn't been the smoothest, we have our committees up and running again, right? Mobily. And then the last thing that we had to do as a result of us moving into a true mutual aid space, we have two events, one called Wellness Wednesdays and Sunday Strong, where we're able to bring a lot of the organizers and volunteers back and really engage folks in a socially responsible manner. I would just encourage folks to hop on our Facebook page and other places to see how that's going down.
And can you share what that Facebook page is?
Oh yeah, Los Angeles Community Action Network on Facebook,
Great.
and LA Can Network on Twitter.
Great. And Janelle, for you, the same question: how has your organization positioned itself in this time period?
I would echo some of what both of y'all are saying, specifically, Martha, what you were saying about being flexible, because, you know, sometimes it's like this false dichotomy between services and organizing. And so we're like, oh, well, we organize, we don't do services. And no, maybe you do, you know, or we're not healthcare provider, or maybe you are. So, you know, there's definitely some of that just challenging of, you know, some things that we thought we might have been very sure of, when in truth it's like, this is what the moment calls for. And so, yeah, a lot of shift into virtual programming. And so for us, that looks like doing a panel and bringing together really folks who could bring like resources and information to Black workers. So like folks from ZEVIC, from the Labor Commissioner's Office, to help keep people aware of what their rights are. We're still running our legal clinic, but we're doing that remotely. So folks are checking in via phone for that. And our Ready to Work program, that was one of the biggest challenges, was getting that ready to go remote. Because, you know, like you were saying, P, like we weren't set up to do that and we hadn't done that before. And I've been so impressed with how people responded, how people, you know, just really let us know what they needed. And, you know, the team, and being able to get it online and get it going and figure out how to use, you know, all the tools at our disposal. Because I think, at least for that first few weeks where everybody was at home, everybody was just like, how do we figure out Zoom? You know, you had the super advanced people who could do the virtual background, and that was pretty much it. So then we're like, wait, this is not just Zoom. We still have the postal service is still out working. We can still interact with people in that way. We still have phone trees. I mean, that's one thing about being an organizer. You spend so much time preparing for the crisis before it hits, but you're in the middle of the crisis. So when there's another crisis on top of that crisis, you're like, oh, okay, you know, there's a moment of what do we do? And it's like, we do know what to do. We've been getting ready for this. And so it's, you know, we spent a lot of time talking, of course, about leadership development. And it's like, well, the leadership been developed, it's time to go. So, you know, we have, you know, folks checking on each other because, you know, like we were saying, the connectivity is really different for folks. One of the things that we're doing, we're still talking with folks about the census. And so we're specifically phone banking around that, but using those conversations to talk with people about the long-term impact of, you know, this crisis, because people are already starting to try to have conversations about post-COVID when we know that the crisis is going to last much longer for our communities here in South LA. So, you know, we know that the census is one of those things that we can directly track. This is a 10-year impact. The census that you don't fill out today is resources that we will not have in the year 2030. So, you know, starting to have those conversations with folks. We were able to partner with the Advancement Project to get some more information. They did a whole study about what the different curves will look like, because we had one conversation in which, you know, like I said, folks were talking about the curve and the peak for the virus. And it was obvious to me, just like everything else, you know, they say there's the this, and then there's always the black this. And so there's got to be a black curve. And if there is a black curve, then that implies that there is a curve for Latinx folks. There's a curve for Indigenous folks. There's, you know, all of these different curves that will require different interventions in order to, you know, help everybody get right. And so, you know, that's assisting with some of the long-term conversations that we're having with folks. And lastly, of course, is to bring testing, because, you know, we're having conversations with folks. We're not sector specific, so it's Black workers across the board. So some people are able to work at home. Some people, you know, just been sent home from work, and some people are still working but not at home. And so we've met a lot of folks who believe they've been exposed at work. And, you know, we're just doing the best we can to walk that path with them.
Thank you. We have a question on the chat from Regina Freer asking that, you know, how do you avoid avoid becoming a charity in this time period, and how do you sustain this work in a way that it continues to be radical?
Yeah,
Pete,
I would say,
I'm gonna ask you to answer that one.
Yeah. I would say, and I'm smiling at Regina. Great question, Regina. So I've talked about this a lot. So one of the things I would first say is when we think about mutual aid, just the concept of mutual aid is how we join together, right? And how we build a network of goods together, right? But then when I put another layer on that, and I think about the Black radical tradition, like this has been part, like us taking care of one another has always been part of our radical Black tradition of organizing. And it was always weird to me, like what happened between sort of the 30s, 40s, and 50s, 60s, and 70s up to the Black Panther Party, right? Who's creating breakfast programs and health care initiatives, and then nothing, right? Then this gulf of divide that says either you are a service provider or you're a political organization, right? And so what I'm seeing in this moment, I take my hat off to folks who do services every day. Couldn't do it, right? I'm tired as hell, y'all. However, I also know that there is some currency that's being built now while we're doing all of this mutual aid work. Now, for us, and this is for me and my organizers, it's how do you convert this mutual aid, these food programs, these health programs, how do you convert that into building political power? That's the question, right? And hopefully in a couple of months, I'll have the answer for you. But right now, it's been a combination of cultural programming. It's been a whole lot of online stuff. I got a bug flying around me. That's what I'm doing, y'all. That's what I'm doing. There's been just a continuation of the work that we've been doing, but more mobily. But my more direct answer to that question is, it's a return to the past. Like, how do we join sort of the radical tradition of providing services and political work together in this moment to bring more folks together?
Thank you.
Yeah.
Someone was going to add. Go ahead.
Yeah, I did want to add to that I think there's always, I hate to use the word opportunity, but yeah, there's always a time for building power. You know, when folks are, and I'll use the example of folks coming by the mobile clinic and getting tested, there's always an opportunity to ask the agitational question, why? Why are you here? Why am I here? Why did this happen? Why you? And when we start to ask those questions, then we start to take it to a power building place. And just like you were saying, Pete, about like a currency that's being built, one of the great gifts of being an organizer is that we get to be present for people when they put those pieces together. And I think that's one of the greatest parts of it, that we bear witness to people, coming into consciousness. And if we're able to be there for folks when they have that moment and help them address the whys behind it, then yeah, there will always be, or there can always be, a power building moment behind it.
So I want to, elaborate on this because, as you all have began to touch upon, is the issue of organizing and, in the context of this virtual world that we're all having to adapt to rapidly. So I'm wondering if you all have, could speak to what you're learning about organizing using phone and internet. And is there, what creative ways have you all discovered to stay connected to your members, to build, with your bases, but also, how do you see us sustaining this for the long term to have a broader reach in this context?
I don't know, Elmer, I'm in them streets. Like, I would say 70% of us are still in the streets, right? And so while we've also migrated to online meetings and things of that nature, we're looking for every opportunity. That's why we have Sunday Strong, and that's why we have Wellness Wednesdays, to bring our folks back together. There's never going to be a situation that replaces the one-on-one, even if it's 6 foot away, organizing, relationship building that's required. Right. And so, we're moving, we're reimagining the ways in which we all need to be in the office all the time at the same time. But that does not discount the fact that we know people have to be there on the front lines and ready, right? Making sure that we have all the PPP that's required, but standing in, provided, and we know things change every 4 minutes, but provided, folks ain't immune compromised and don't have family members that could be sick, or if you're Black, dead, or if you're brown, dead, right? Our folks are showing up, man, showing up. Not showing up in the same way, definitely not showing up 10, 12 hours a day, really reduced days, but folks are showing up. There's no replacement.
Got it. Martha, do you want to share?
Well, we do policy advocacy work, but we work with groups who are doing the organizing, right? If it's a training or whatever we do. So we have not done the mutual aid, but it's really important. What I have seen, and this is what we do, is a lot of sort of social movement configurations, having conversations together. So we're part of these peer learning circles with national groups who are working around this just transition. What does a new economy look like in climate? We've been talking to groups in New York who are developing mesh networks, which are, phone-based networks for communities, really hyper-local, where you don't have to depend on, some big corporation. So we're really trying to figure out, what we usually do. We sort of try to look out into the future a bit and forecast what are some of the trends in both in terms of organizing and campaign work that we can then, engage with our members and then with our wide array of allies, right? So in our oil work, folks are getting on the phone doing what they used to do, right? Phone trees and others, and filling the digital divide. And we are talking about how other creative ways, this is car culture. Do we all show up in our cars somewhere and do a protest, right? What are the tools that we have to continue to defend democracy? And then the other part, which for me is kind of exciting, is these bigger conversations about how do we take this political moment and do what the right does, right? This is the chance to demand big things, right? Eliminate debt. Just like the things that we know are keeping us from building wealth, at the same time that we want to, we really want to change capitalism in a fundamental way. We want to move beyond an extractive economy to a restorative one. And this is a moment where we can actually talk about that, right? Because this economy doesn't work for people. And now we see that, right? Essential workers are the least valued, farm workers. So I'm about, we got to build those networks to build that power and then make the strong demands, right? The really bold demands, and then exert that power in a way that's visible. So I'm like, general strike, right? I don't know when, but we need a general strike. We need to shut it down in ways that really scares them, because I don't think that they will respond to anything else.
Janelle, do you want to add?
Yeah, I would just echo what Pete was saying about how you cannot replace the one-on-one. It's not a thing. I'm also glad that you said a lot of people are still outside, because it's true. Everybody's still outside. Mm-hmm. Yeah, it's so important, especially because as we start to, see some of these wins come through, as we start to see more resources, coming in the community, folks are distrustful. They're not going to go run out there just because Gavin said so. You have to talk to people one-on-one, especially for folks in community who ain't got no papers. They need to hear from somebody who they trust that it's okay. You need to, just like I said, just because, Gavin or Gar said, he said, okay, it's good. Like, it might be. Yeah, I want to hear from my cousin. I want to hear from my coworker. You really can't replace that one-on-one conversation.
So I want to talk about resources, and in this time period, we're talking about what this has done to the economy, and deficits are reserved for people of color and human needs, and abundance tends to be whenever you're talking about corporate interests and, more affluent communities. So in this context, can you talk about the need for us to, demand that resources continue to be directed at, low-income communities, the needs of humans, and, particularly people of color and communities of color, that, before this, there was a lot of need in our communities and, lack of funding when it came to the needs of serving our communities. And now, we're going to start hearing more and more about how there isn't enough to go around to serve our people. And so can you, talk about the importance of organizing to ensure that we get, a cut of the resources that are going to be allocated for COVID relief? So I'm going to ask Pete for you to jump in. I see you're ready for this one.
No, I'm just smiling, man, because I was trying to figure out the time when there was enough need, or not the time when there was enough need, but when there was a flow of resources that came into our communities to address the need, right? And so it's an interesting time. COVID produces an interesting time where others have needs that we can extract from, right? Any conversation that they're having right now, the stimulus dollars, almost $2 billion, they ain't talking about South Central Los Angeles, right? They're talking about how they're going to bail out corporations, right? They're talking about how they give resources to their friends. I think it's really interesting, and I think I have to lift this. I think it's really interesting that about 40 white dudes in Wisconsin, armed with shotguns, could run up in a state house a couple of times and they open the entire economy back, right? They're like, yo, white men, they tripping, let's open the entire economy, because the workers who are gonna go back, those essential workers, are gonna be Black and brown folks, who, by the way, are dying. Because if you're Black and in St. Louis, 100% of the deaths were Black people, right? If you're Latino in Chicago, 60% of the impacted rate in Illinois right now are Latino, right? And so what they're talking about is, how do we get the resources flowing for our communities? What we need to be talking about, because we know it's roughly like $2 billion that's showing up, what's our plan to take those resources into our community? Because if we don't, it's all going to be done in our name, but not in our state. They're already setting it up. And so we've got to separate the rhetoric from our plan right now. And we don't have a whole lot of time to do it, right? Maybe it's the time for a Black and brown Marshall Plan with some of that $2 billion that's coming our way. But we can't wait. We can't wait.
Janelle, do you want to add?
I really think you said it. I think that's it.
Mm-hmm.
I think that's it.
Got it. Martha, anything you'd like to add?
No, I mean, other than if we don't do this, it will happen to our communities and it will deepen inequality. And that's, I think, the part that really scares me, right? Will we do this wrong? And, it worries me.
I want to touch on the issue of race. And you started the conversation, Pete, about Black and brown folks and the need for Black and brown people to organize for what you call the Marshall Plan. But, I'd love to have you all share your thoughts on, the racial conversation that COVID-19 has elevated, but in particular, the need for Black and brown folks to continue working together and collaborating in this time period where you see stuff happening that, continues to want to divide our community. So I'll ask Janelle, why don't you take us off on this question?
Yeah, I think the need for solidarity is going to be crucial, and it has to be genuine solidarity. The way that I could explain it best is, I'm screwed because you're screwed, and I get free because you're free. That is the best way that I can explain it. And so there is, very much a moment of like, I am you. When we speak of undocumented folks, I'm talking about, yes, folks in Latinx community and undocumented Black. And we need to look out for all of our folks together. We share this community together. It's not an option to have folks over here get healthy and folks over there don't. We finna be sick together. At the same time, we have distinct needs. We have distinct issues. And so they need to be, addressed in that way. And so I think, you know, until we get to that, you know, as they call it, radical solidarity, that radical kind of unity, you know. And I think that it exists in a lot of places. You know, I think that although, like, yeah, there's a lot of anti-Blackness, there's a lot of, you know, racism that is holding us apart. I have seen spaces where we have come together. So I'm not going to sit here and speak as if it's not a thing. It's both. There's anti-Blackness that's tearing us apart. And there is also, and there's xenophobia that is tearing us apart. But there's a lot of beautiful places of unity where we do coexist.
Yeah. Martha, can you add to this conversation?
I mean, I think absolutely, right? How do we practice that radical solidarity rooted in deep love so that we can hold ourselves with kindness as we walk through things that are hard, right? And you know, look at ourselves and look at systems, how they operate. And I also think this is a moment that gives us that opportunity to talk about why that solidarity is incredibly important. And, you know, we build that every day with the work that all of us are doing, right? And sometimes we do it really well and sometimes not so well. But, you know, my big thing is, let's just not play the oppression Olympics. You know, we are in this in many ways together, and we just have to hold that sometimes things will be uncomfortable, but we don't have much choice now.
Pete?
Yeah, I mean, for me, and before I do it, I want to just shout out the remaining 98 participants who have been with us for this hour plus. Thank y'all, thank y'all, thank y'all. I'm looking forward to y'all's, some of y'all are already lighting up the chat and the Q&A. Keep it coming. I'm looking forward to hearing and bringing y'all in. Just want to shout y'all out. I'm just going to bring Lila Watson. I'm bringing two women, two Black women, right? Lila Watson said very clearly, if you have come to help me, turn around and walk out the door. If you've come because you understand your lot is connected to mine, then let us work together. That's one. The second one is a safe space ain't a comfortable space. Like, everyone's not impacted in the same way, but if we interrogate this shit enough, we'll see we have the same enemy. And so I think now is the time that people are we gonna say woke, right? The window opened just a crack where we can show, right? We can show the disparity. Right now, we can show that what racism is. It's a system of advantage rooted in tradition, culture, and race. Or we can go the Ruthie Gilmore route and say that capitalism divides us and racism enshrines that division, right? Why do I bring these women? It's time now to interject, to bring the voices of the ancestors and the living to the fore, to get ready for this $2 billion. Not that $2 billion is all that much money, but it is more than we've seen in a long time, in a targeted way to lift our folks out, and getting really, really creative about the ways in which we want to spend those resources. And I'll pull it up there.
Mm-hmm.
Great. And with that, we want to open it up now for questions from the remaining 97 participants. So this is your time to shine. If you could please ask your questions via the Q&A chat box, and we will do our best to get to as many of these questions as possible. There's one here, says, can you expand on how this pivotal moment around education inequity contributes to furthering racial-based disparities? Any of you want to take this one?
I missed it. I'm over here answering chats.
Oh, okay, got it.
I was going to say, I got excited and started reading the chat. Can you repeat it?
So it says, can you expand on how this pivotal moment around education inequity contributes to furthering racial-based disparities? So it's talking about students and education.
I mean, so really quickly. So I got a 14-year-old. My youngest is a 14-year-old, right in school, right? His school was definitely not ready for the online transition, right? Now I know some folks whose kids go to Crossroads and all of that other stuff, right? Who's already been engaged in online learning, right? And so our children are getting pushed further back, right? And during this COVID crisis with an unknown return to school date, where other folks' kids have just rolled right through. And I'm uncertain about what that's going to do. I'm not really uncertain, but kind of uncertain about what that's going to do to the development of Black and brown children in South Central Los Angeles, right? Kids who are barely hanging on in the first place.
Yeah, well, it's estimated that students are losing between 35% to 50% of their learning in this time period, particularly in math. So the disparities are definitely there. And while systems are responding, you know, LAUSD has invested significantly in feeding more families and purchasing technology for families and students. We know that it's taking a long time to roll it out, and we have yet to catch up to make sure that every teacher and, you know, is ready to deliver in the, you know, at the same level, right? There's a lot of difference in the way that not only the platforms are serving, but also the lessons are being delivered. So anybody else want to add to this question about education and equity?
You know, a part of me wants to affirm education that happens, you know, outside of the classroom, because I know that there's a lot that people are learning right now, like outside of school. But this is one of the concrete ways that's gonna hold a lot of us back, you know. And so even though I do, you know, want to speak that affirmation, you know, in spite of obviously the harsh, you know, reality that this is gonna spell out for folks.
Thank you. We have another, Martha, anything you'd like to add to the education question? No? Okay. Maybe you can answer this one then, Martha. Any potential for deeper collaboration among organizing groups as a result of this crisis? We'll start with you and then we'll open it up for others.
Well, that we've already seen, everything from this group of young physicians that I'm working with that are like, they are really interested in being the health voice on the people's bailout, and they really want to make sure that they're watchdogging what's happening. And, you know, they're young and they're on the front lines, and they're still, you know, in the middle of the night, they're emailing me and asking for stuff. So, and then this, you know, these broader configurations of folks who've come together, like the Environmental Justice and Health Alliance, who's really leading the charge with, you know, folks from all over the country around the rollbacks to the Clean Air Act, and industry saying, oh, under COVID, we just can't, you know, it's just too hard for us to maintain environmental laws, and oh, it's just too hard for us to comply. And so there's a lot of work happening on that front. That's really exciting. In LA, we've got a climate emergency department, the first ever in the country, that was actually designed by Scope and PSR and Communities for a Better Environment and Esperanza Community Housing, with the idea that this would be a place that was where frontline communities could really direct LA's just transition away from oil. And, you know, now that's under attack, but we see that as a place to actually democratize the process around COVID recovery as well. So there's a lot of opportunities. And, you know, we've been working with IDEPSCA, where we were just able to get a grant for them to do green cleaning trainings in Spanish online around how to actually clean for COVID without, you know, overusing bleach and other things that's actually problematic if you've got an asthmatic child, or if you're asthmatic yourself, to be using really harsh chemicals. You know, so I can go down that, but it's new, and we're thinking of, you know, what does this look like? How do we organize day laborers and domestic workers for the future of work, right? What are the opportunities that will be available for them to, you know, to own, to do cooperatives, to show that they can actually, and how do we value their work? Because we've seen, you know, we just don't value the work of poor people. Right? We underpay it, we undervalue it. So there's lots of opportunities, and it's almost like there's not enough time, right? And, you know, I certainly feel that sense of urgency to continue to build movement and power.
Yeah. We also got some shout outs on the chat. So we got a request to read some of them. We got an OG organizer, Elsa Barbosa, who's inviting us all to participate in a virtual town hall with Stacey Abrams this coming Tuesday, May 12th at 6 p.m. So make sure you all stay connected to that one. It's called Building a Caring Economy, a virtual town hall with Stacey Abrams. Pete White getting a lot of shout outs over here, that a safe space isn't a comfortable space. So thanks for teaching us. And then We have Benjamin Torres, Benny on here, shouting us out, telling us that the struggle continues. And then one more that says, we have to encourage people in our communities who refuse to believe the gravity of the situation. What are some of the reasons they don't understand, and how have you chosen to educate them? That's a question for you all about folks who you may see out socializing, not social distancing, not using protective gear, and just your thoughts on that front. Janelle, I'll start with you.
Yeah, that's a hard one because, yeah, I just had to shout my folks out who were telling me that God got me. God got me, I'm good. And I'm like, maybe. It's just a matter of, because the thing is, like, it's hard for me to say I'm educating anyone. I think everybody's quite educated. But, when I'm speaking with them and trying to bring them closer to what's called the scientific truth, okay, God got you, right? God got you food. You still went to the store and cooked it, So if God got you, maybe God brought you this mask right here. Maybe God got you this sanitizer. Like, I don't know. Like, that's the thing. I can't interfere on people's intimate personal relationships. But like my grandmother, we're about to pass our first Mother's Day without her. She's a brilliant woman. My grandmother, she always said, Jesus didn't say be no fool. That was her phrase. And so she said it, like, we knew exactly what she meant, you know what I mean? And so I don't got that kind of status so I can run around telling people that. So it's really more like, asking them questions about, well, you think that God might have brought you these resources to assist? So it's, I don't know. It's a path that we walk in with people, but that is hard.
So if I could just hop in really, really quickly. And so first of all, it was a setup from the get-go, right? And so as soon as folks saw the royals in UK having it, they was like, white folks got it. Tom Hanks came through and it was like, see, it's a white folks disease. Black folks can't get it, right? And at the same time that we continued to have sort of these headlines around celebrities that had it, they were masking the truth in terms of the casualties that we were taking. You weren't seeing the numbers of Black people that were dying. No one was telling Black folks, yo, do you know if you have high blood pressure, hypertension, asthma, that shit could kill you? Like, no one was out there saying that, right? And so it's, for me, on the ground, talking to folks about it every day, when you're real with your communities, no matter who those communities are, they will respond. Like, if you are a trusted messenger, like, I'm out there like, mask up. And of course, I'm getting some folks who like, Jesus Christ got me. I'm like, yeah, but why don't you take this mask for some backup for me and you, right? And we just have to know, right? We have to be able to say to folks, we know what you've seen. We know what the narrative is that they've sold you, but did you know, right? Did you know your community is being hit this way? And we've been, like I said, we've been putting that down. Folks are masking up, folks are washing up, folks are doing everything that they can do to try and protect themselves.
I'm glad you said that, because the God got me crowd is totally different from the 5G crowd, and those require different interventions.
And then Martha, is there anything you want to add? This is right up your alley about folks making sure they're taking personal precautions to also stay safe.
Yes. So, I am a proponent of the precautionary principle. So we started in our office social distancing very early. And I remember even my staff was like, no, I'm like, this is going to be bad. This is going to, and they're like, no, so, but again, we have not seen a lot of that denial in ways that others, because our members are physicians. Where I've been a little nervous, like when I've talked to them, I'm like, how are they going to talk about the health disparities part, right? Our Surgeon General talked about it. It's like something inherently wrong with Black people, and that's why they're getting it, right? Because they're diabetes, they have this, right? Instead of talking about that racism, and white supremacy have shaped the health of Black people for generations. And this happens it layers on top, right? And so I've been like but it's been really heartening to see our physicians, many who are older and white, understand this, right? And so they always restore hope. I'm always like, what are they going to say? But they always come through in terms of understanding root causes. And for them, so I will say that. So I have not encountered, other than within my family, my mom, I can't convince her that it's not okay to go out without a mask and all these things. And yes, and within my family, there have been a lot of I get the emails about, how it started in the wet market, it escaped from the lab, and, Anthony Fauci has something to do with it and all that stuff, right? You're like,
there's a lot of that. We have a question here from a good friend, Susie Coracero, also a longtime organizer in South LA, asking about, similar to what we talked about earlier, but, planning beyond the immediate needs of COVID-19. And, she argues that this is the perfect storm to further push Black and brown people out of South Los Angeles. So I know, Pete, you deal with displacement a lot. So your thoughts on, how this can be used as a way to build up that hype.
Yeah, I mean, she's absolutely right. Just building on something Janelle said earlier, we're part of My Black Count census work, right? But you can't talk about census without talking about redistricting, right? And so this is an opportunity. Let's just think about the mortgage meltdown. Like when people are losing their homes, and I really, where I go to the work of Manuel Pastor when he talks about roots and raíces, right? Where he shows that Black disappearance was happening everywhere in Los Angeles except in one census tract. That one census tract was in Skid Row. Now, multiply that by 10 when you're talking about a 50% unemployment rate, right? And that's only going to grow. It's definitely going to be a dismantling of whatever little political power that we have. And so we have got to organize people to stay, like whatever that looks like, to stay.
mm-hmm.
Got it. Anybody else want to add to that question of displacement of Black and brown folks? We have a question here from Kirkpatrick Tyler. How do we build a response that takes into account Black and brown people's history with medical institutions like the Tuskegee and Pruitt, IGO, and doesn't dismiss Black and brown people's valid mistrust? Martha, I'm gonna throw that one to you.
And just know, is that the mayor's staff? I think that's the mayor's staff, and he's Black.
Okay. Well, yes, that's incredibly true, and I think I think the community clinic structure is one. I think that's why Janelle doing the testing. We're going to have to partner with groups, and I don't know what else to say, because I know that the healthcare system is racist, and whether you think you're a physician and a good person, we still know that the pain of Black women is discounted. Blacks will be amputated more for diabetes than white. So we just know that it is imbued with that, and you kind of it's not the best answer, but you have to go anyway. And you have to be a good advocate, and there's where the advocacy community could really help in terms of being able to navigate those structures with folks. That said, we need to do universal testing. We need to participate in that universal testing so that we know where the hotspots are. As we move forward with what's going to happen next, we've got to fight for that universal testing, and we've got to fight for Black and brown and Indigenous communities to be part of that testing. Otherwise, we will be the second round of casualties if we're not ready for that. So I think we work with the best physicians that you can, so that you are working simultaneously to eliminate that kind of implicit bias that exists within the clinical setting. But yeah, we're right not to trust. I don't know what else to say about that.
Got it. Yeah. And I'm going to ask one last question from the chat, and then we're going to move to closing. A question that I'm going to paraphrase a little bit, but talking about keeping the pressure on elected officials, and, you know, especially those who may look like us and may sound reasonable in comparison to President Trump. But we'll try to use their bully pulpit, to try to calm down organizers, especially those that are pushing for a more radical response to this crisis. And how do we make sure that we hold them accountable the way that we would anybody who we consider to not be as close to us as someone like Trump?
Quick answer, just remember, all skin folk ain't kinfolk. All skin folk ain't kinfolk, right? And so you're still dealing with power.
Got it. Anybody else wants to add before we move to closing?
You said that they were folks who sound reasonable in comparison to Trump. Who does not sound reasonable in comparison to Trump? I want to know.
That it's too late for that standard.
Uh-huh.
Right. That's rock bottom.
Yeah.
No,
yeah,
it's awful. I mean, I was on a call yesterday and I'm like, why aren't we just opposing that? It's awful. It's an awful idea. Just oppose it. And people are like, well, we're trying to maintain the relationship. And I'm like, you know, that thinking hasn't worked out for us. So, you know, I envision us, you know, doing car protests at people's homes in South LA, if that's where you live, because I think it's time to stop making excuses for people who are supposed to represent us, and remember that they lose by really small margins. And so getting out there and voting is important, but holding them accountable and calling them out as often as possible so that they don't get so comfortable in their positions.
Great.
Yeah, I think we can only do right by folks, honestly, by listening to our members, by listening to folks in community, because people ain't crazy. They know what they need. They know what they need to do.
Mm-hmm.
Great. All right. Thank you all. Really appreciate you for your time, your expertise, your wisdom that you shared with us, your humor, of course, keeping us smiling even as we talk about these really difficult topics. And thank you to the 87 participants who remain with us. Y'all are the real champs on this chat. Thank you. Yeah, big clap for all of you. Just letting folks know that this is part one of a 3-part webinar series. The second session is going to touch on the nuts and bolts of policy organizing during COVID-19. Part 3 is going to talk about the dimensions of democracy and equality in the age of COVID and what it means for us. That's a really deep, whoever wrote that is a real poet. So thank you for articulating it that way. And just thank you to the panelists. Again, your expertise goes a long way. Like all the participants, I really appreciate learning from you, and I really appreciate what you do in our communities, but more importantly, how you're sharing what you know with the rest of us so that we can duplicate it in our organizations and ultimately in the work that we are doing. So we also want to thank the organizers of this webinar, SSG, SCOPE, California Endowment, all the members of the BHC that continue to hold it down for South Los Angeles, making sure this remains the beautiful community that we all know it to be. Even with all of its challenges, we all call this place home, and we want to make sure that it remains beautiful for all of us. So thank you all for taking the time to be here with us. We hope you will join us for parts 2 and 3 and keep organizing, keep that radical work moving, because we need to keep pressure to make sure that our folks are well represented and taken care of in this time period. So thank you, and have a good rest of your afternoon.
Thank you. Thank you.
Bye, y'all.
Elmer.
Thank you so much.
Thank you.
Bye, P. Bye, Martha.
Bye.
Bye, Brian.
Bye, 45 participants.
Bye, Sonia.